Mr. Bachchan is a 45 years old on-the-go lorry driver who was admitted to the hospital due to unresolved angina. He has been diagnosed with angina last month and was prescribed with sublingual GTN tablet. He is a compliant patient and his condition is stabilized now and he is going to be discharged today. When he was admitted, the chief complaint was that the chest pain does not go away after taking the sublingual GTN tablet, and he was experiencing unresolved chest pain for the first time.
Can I pay? Yes, Mr. Bachchan. Can I call you Bachchan?
Yes.
Okay. So I hear you will be discharged today, right?
Yes.
So I will explain a little bit about your drugs. So how are you feeling today? It's okay?
The pharmacist should greet the patient in a friendly way. He is showing good gesture and making eye contact with the patient. This is to overcome the personal barrier between the pharmacist and the patient.
Feeling fine.
Okay, I hear that you are here because you not feel relief from your chest pain. Can you explain more how you take and how you feeling when you take your drugs?
Firstly, the pharmacist tries to make the patient feel comfortable and get the patient to explain the problem that he is having.
Usually when I take the pill, I feel relief. But yesterday, I not feel anything when I put the pills under my tongue.
How do you feel when you take the medication before? Any feels
I feel hot sensation.
sensation when you take your drugs, right? Okay. So actually, you need to feel that sensation because it is an indicator that the drug is working for you. But can I know how you keep the drugs at your home or when you are work?
At home, I put it in my container to prevent from reach from my children. And as you know, I'm a lorry driver. So I take up and put in my lorry.
Okay, actually that's the problem.
Then, the pharmacist is able to identify the wrong perception that the patient has towards his medication, which is the wrong way to store his medication. She can also detect the potential barrier to patients' learning, which is low literacy. To overcome the problem, the pharmacist has to explain the proper way of storing and taking the medications.
You should not put the drugs into another container because you know this is the bottle color is quite different from another one because it prevents from direct hits. Okay, so you should not put your drugs into another container first. Then, as I know you are working as a lorry driver, if can, please do not put your drugs in your lorry because it may expose to direct sunlight and also heat. And if can also, please do take your medication immediately after you take out from the container. Because you don't feel any sensation, right? That's mean that your drug is not effective anymore. That's the problem. Okay, so another drug is prescribed for you just the same like before. I will explain to you briefly once and then I need you for final verification. Okay, this is aspirin for your height also.
Pharmacists also need to use the show and tell technique to counsel the patient about other medications.
Please take it after your breakfast. Okay. This one a bit longer, simvastatin. It also please take it before your sleep. It for your cholesterol. Okay. And lastly, these round drugs takes twice a day, at morning and also at night. Okay. Can you please explain to me one more time?
The first one is aspirin.
Lastly, final verification technique is used to assess the patient's understanding.
Take after my breakfast.
Yeah.
Simvastatin, the long one, take before I sleep. And the last one, 2 times daily.
Yes, 2 times daily. Okay. Do you have any questions?
I feel headache when I take
This drug. Okay. If you would like to prevent those feeling, okay, you should sit down properly when you take the GTN, and then before you get up, just sit down and properly And then after takes, wait for a few minutes before you start you doing. Yeah, it will prevent you from feeling headache or fall. Okay, any more question?
For the medication, if I miss this, do I need to take double?
Okay. You should not take double. Just take it accordingly, and please do compliance. Take it accordingly, appropriately at the correct time. Okay. So, do you have any more question? Okay. So
Before ending the counselling, the pharmacist asks the patient whether he has any question.
I hope you will be fine, and we meet another month, but not yet here. Okay. Okay. Thank you very much.